Hi, Jesse. I'm Mary Kate. I'm going to be your nurse today. Before we get started, could you possibly tell me why you came in here today?
I got a DWI, and this is part of the probation.
And how do you think that your treatment's going so far?
Well, I've been 6 months sober so far, so.
Good. And you feel like your plan's going really well so far with everything?
Yep, just trying to get off probation.
Right. Just how do you feel like your family's supporting you throughout this process?
My family could be a little more supportive.
All right.
So.
And do you have a spouse or
Yes.
a relationship?
And she blames me for my drinking problems.
All right. Okay. Well, we're just going to go over a few questions. We go through all of this with all of our patients, just so you know everything is confidential that you tell me. Is it okay if we go over it? It's a little bit touchy. It's just about your relationship and all of what you're going through right now.
Yeah, that's fine.
Okay. Well, let's get started. If at any point you feel uncomfortable, just let me know. We can stop. Okay. In general, how would you describe your relationship? A lot of tension, some tension, and no tension.
A lot of tension.
Okay, and do you and your partner work out arguments with great difficulty, some difficulty, or no difficulty?
Great difficulty.
And do your arguments ever result in feeling down or bad about yourself? Often, sometimes, or never?
Sometimes.
Okay, and do you ever feel frightened by what your parents say or do, partner says or does?
Sometimes.
Okay, and then has your partner ever abused you physically? Often, sometimes, or never?
Sometimes.
Okay, and has your partner ever abused you emotionally? Often, sometimes, or never?
Often.
All right, thank you so much for telling me about all of that. As I said before, everything is confidential. I know you said that you are physically harmed sometimes, and that you feel like there's a lot of tension. Would you be willing to explain any of that to me or talk about any of that?
Well, since I've had this drinking problem because of my experience with the military, and my wife just kind of blames me, and she doesn't want me hanging out with my friends because I drink with them a lot, and so she definitely is not supportive.
Yeah. And do you feel like maybe going through this alcohol program will help with that, or do you think that she's just not supportive with you getting help at all or anything through this?
She threatens to take the kids. So.
Okay, and just something that we have to ask since there are kids involved. I know you said that your partner sometimes physically abuses you. Is there any of that towards children or emotional abuse? No. Okay, just making sure. Is there anything? We just like to give this card to you, just because you can give it to friends or family if you want, but it's just any type of resources if you do ever feel like you're being any part of domestic violence. You can just keep that. There's numbers on there if you need it. Would you like to go over a plan with me of what we can do just in case you ever do feel like you're in that type of situation?
Sure.
Okay. Just some things that we like to consider are whether or not you have a family member that you could talk about this with, or if you have any type of area where you can go or a place where you can go with a friend or family, or just try to back away from the situation, try to stop the conversation in front of the kids maybe. Do you feel like there's anywhere that you could go or anybody you could talk to about this?
Yes, I'd probably just take the kids and get out.
Okay. And I know, would you have a place to go with them, you think?
I don't know. I'm not really close with my family because of this.
All right. Well, if you ever feel like you need a place to go, obviously this is a safe place. If you need to go somewhere, there's always people here for you to talk to. If there's that type of scenario where you don't feel safe, so just always know that this place is here for you, and it's a great place for you to come if you need anything.
Okay.
All right. Any other questions?
Nope.
All right. Well, then we'll get ready for your therapy then.
All right. Thank you.
Thanks so much for talking to me.